This is what you need to know about your safety critical medical. Safety critical medicals are a series of health checks given at work to people in safety critical jobs. Some examples of safety critical roles can include driving, working at height, or working in confined spaces. What we are looking to rule out is any of the following occurring whilst an employee is doing a safety critical role. Sudden loss of consciousness, impairment of awareness or concentration, sudden incapacity, impairment of balance or coordination, significant limitation of mobility. In order to rule this out, Latus Group will conduct a series of assessments to get a current and full overview of an employee's health at the time of the medical appointment. The medical will include a general health assessment, a musculoskeletal assessment, a vision assessment, an audiometry test, a lung function test, a skin assessment, and a HAVS assessment. These are the assessments that are carried out at each medical. Audiometry assessment. This includes the hearing questionnaire, an otoscope exam where we'll examine the inside of the person's ear, and the hearing test itself. A lung function test. This includes a lung function questionnaire, a blood pressure test, and the spirometry test. The skin assessment. This will involve a series of questions on the employee's skin, and then it will be a visual inspection of the employee's hands, forearms, and visible skin around the employee's neck. The HAVS assessment. Employees who regularly operate vibrating tools or machinery will undertake a questionnaire where we will assess their risk of vibration-related illnesses such as hand-arm vibration syndrome, carpal tunnel syndrome, or Raynaud's. This is to determine whether their level of exposure is having any potential health implications on the employee and whether any further investigation is required. Vision assessment. This will include a near vision assessment, a Snellen distance vision assessment, a peripheral vision screening, and the Ishihara colour vision assessment. The musculoskeletal or MSK assessment is to evaluate whether employees have the physical capabilities to perform their job role. This will include a questionnaire on their general movements, and then they will perform a variety of light movements. The general health assessment includes a questionnaire on the person's medical history and current health conditions, a urinalysis assessment where we will assess for any abnormalities in the person's urine, such as poorly managed diabetes. During the assessment itself, our clinician may need to call one of our clinical escalations team for support. This is a team of fully trained and qualified occupational health nurses who are on hand to help determine your fitness for work, therefore ensuring the safety of others and yourself at work. The potential outcomes of your medical could be: you're fit, you can head back to work and continue your role as normal. You're fit, but we may recommend you visit your GP to get further investigations into something we've identified. You're restricted from certain elements of your role. In some instances, we may identify something that requires further investigation before you can carry out certain elements of your role again. If you are restricted, don't worry. This can be common and is purely there for the safety of yourself and others at work. Before your appointment, please avoid caffeine, smoking and vaping for at least 2 hours. Ideally, please avoid these for 24 hours before your appointment. We hope you have found this video helpful, and we look forward to welcoming you to one of our medicals soon. For more information on Latus Group, please visit our website.